Good afternoon. So today we're going to be going over the hip and how to check for your range of motion, whether that be through active or passive range of motion. With the active range of motion, the athlete will be doing the movements for themselves, and you're just seeing how far they can manage to move their leg or to move that hip into flexion, extension, abduction, adduction, anything of that sort, as well as rotation. But when you use passive, that's when you're going to be measuring for what degrees they're able to reach in that range of motion, and you're also going to assist in that process as they get there. So maybe you can give a little bit of a push to get that last little bit of tension to see how much that joint is able to move. So we're going to go ahead and get started here. Things that you have to have before you can get set and do your range of motion is, of course, your handy dandy goniometer, which is going to help you measure those angles and degrees for each of the range of motions. You'll have to have a athletic training table, in this case a makeshift table. It will do the trick. And then, of course, you'll have to have your athlete. Once they're there, you'll get them into the correct position for the specific motions you're going to go over. So while in the supine position, you're able to check for flexion as well as adduction and abduction. And then you have to move to a different position to do your extension and your rotation. But to get started, you're going to take the proximal arm to check flexion. You want to take that proximal arm and you want to line it along the midline of the body, and you want the center of the goniometer to be over the greater trochanter. And then once you have that, you're going to line the distal or dynamic arm along with the femur, and you're going to have that athlete go ahead and pull their knee up. Knee can be flexed just like that. And then you're going to measure. All right, you're good, relax. And then you can measure how far they made it. So with the knee flex, normal range of motion is about 90 degrees. So everything is good. In this case, now if you were to do this again with the knee extended, normally that's when you're going to get the about 90 degrees. So with it flex, actually the normal is anywhere from 115 to 125. So going on for the adduction and abduction, so how you're going to get set up to measure that, you're going to take your proximal arm and you're going to lay it along the line that goes between the left and right aces, and you want the center of your goniometer to be over the ipsilateral aces, and then you want the dynamic arm to be going down the femur with it pointed towards the patella as a reference point. So then what you'll do, you're going to have your athlete move their leg laterally if you're checking abduction. So you're going to slide out to the side as far as it can go. All right. So here we've got just about 36 or so degrees, which is good. Your normal range of motion for abduction is 45, 50-ish, or somewhere in that range. And then when you do it again for adduction, so adduction, you can do the same thing, get everything set, and then this time you will go and move the leg to the inside, measure, perfect. And then on this one, you're going to expect to get a little bit less, looking at 27, 28-ish degrees of motion there. So with that, you have all of your supine positions done. The next thing you'll want to do is check for extension. So for this, you're going to have the patient lay in the prone or on their stomach. And so what you'll do is the same kind of setup you're going to have your goniometer set so that you can put the proximal arm along the midline, and then you'll take and use your distal arm along the side of the femur with it located on the greater trochanter. If you have the space, you can also do the extension by having them let the leg lay off of the table, but in this case, we're going to go ahead and have our athlete roll over on their stomach and then check the extension that way. Alright, so like I just said, proximal arm along the midline, center over the greater trochanter, and your distal arm along the femur, and then you're going to have them lift their leg up as much as they can. Alright, perfect. And so for this one, it's usually a pretty small number, somewhere between 0 to 15. We got about 5 here. So a lot of times if you're looking to get a better idea, like I said, that letting the leg hang off of the table can help with getting a better picture of what that extension ability is in the hip, because it does take a little bit of strength to get that movement, get that motion made while laying on the stomach. Last but not least, you have to check the rotation. We'll take a quick pause and change to our sitting position to check rotation.